wash your hands using the prescribed 5 counts and assuming that I already washed my hands. So don't forget to sanitize it. Okay? After doing it, provide patient privacy. Ma'am, please allow me to close the curtains for your privacy. Is that okay with you? Okay, thank you, ma'am. And then we can now verify our patient using 2 identifiers. Ma'am, may I know what is your name? Okay, Mrs. Manoban, what is your birthday? Okay, thank you so much. And then after verifying it, we can now put our gloves. Now, we can introduce ourselves to establish rapport to our patient. Good morning, ma'am. I am Nurse Kristel and I am your nurse for today. So today, ma'am, we were going to assess you from head to toe. Is that okay with you? Okay, ma'am. Thank you. So we were going to assess you from your postpartum, okay? Okay, thank you, ma'am. The first thing that we need to do in bubble he assessment is to assess the mother's breast. And then we're gonna ask the mother, Mommy, how do you feel right now with your breast? And then she could say variety things such as her breast feel heavy. It's like feeling full of milk. And then as a nurse, we need to respond to the mother that it is normal and okay to the breast that they may feel heavy, okay? And then after asking the mother, we can now assess for the both breast. Okay, the mother would say to the nurse that her breast size are not same. One breast is slightly larger than the other one. And then as a nurse also, we need to explain to the mother that it is normal for one breast to be slightly larger than the other breast. And then next, we can now assess the nipples. Okay, for the nipples, the mother may say her nipples are different in size. And it is normal to have different size of nipple or on each breast, okay? And then next, we can now check the condition of the skin of the breast. Okay, for the proper assessment of the breast, we need to check the presence of stretch marks, orange peel appearance, or they appear like smooth. Okay, again. Okay, the breast is in normal condition of the skin. Next, take note for the temperature of the nipples. We can use the back part of our hands to determine if the nipples are cool, warm, or hot to touch. Okay, the temperature of the nipples is warm. Next, assess the types of nipple. Whether it is everted, which the nipples are out, like this. For example, this is the breast and then this is the nipple. It is like out. And then for the inverted, which is like concave going. Or the flat where the nipple is unable to out. Okay? Assess now. Okay, the mother's nipple is inverted, which means nipples are out. Always remember that whatever type of nipple it is normal and it is not a barrier for breastfeeding. Take note that bruising, suck marks, cracks, or bleeding in nipples are signs of no good latch. Lastly, assess for the areola. Check if the areola has presence of bruising, suck marks, cracks, or bleeding. Okay, the areola of the breast of the mother is in well condition. Take note that it is possibly doing improper breastfeeding if there is a presence of bruising, suck marks, cracks, or bleeding. Advise the mother to proper breastfeed her child to prevent this. Next, we can now assess the uterus and then we need to check for the fundus of the mother. First, we need to position the mother in perfectly flat. Okay, because flat position may result to accurate assessment and provide comfort to the mother. And then next, we can now expose the abdomen of the mother to locate the fundus. Okay, use 2 hands for a fundal check, and then the one hand is supported to the bottom of the uterus, and then the one hand is actually filled the fundus. So the mother is delivered today. So it should be in the midline here. And it should be in the level of the belly button here. Okay, let's find out or detect. Okay, it's here. Next, and then we need to describe now the fundus, firm with massage or baggy. Okay. Okay, the fundus is firm. When the mother is thin in appearance, the fundus is hard like rock, okay? Which is normal also. But most of the women's fundus is firm like tennis ball, squishy, bouncing back, okay? When it comes to firm with massage, massage a little bit and you can find squishy but it can be located. And it starts to firm up and get hard, okay? And then good, that's good and firm. And then which is normal also. Otherwise, if the fundus is baggy uterus is not good, which is squishy. But when massage is failed to be firm, this is a sign now of possible hemorrhage. Next, we need to do the proper palpation of the uterus like this. Okay? Okay. Painless can be seen with proper direction and fast, but make sure the palpation as possible, okay? And then consider also some post-cesarean section to the mother with their pain in the incision site, okay? When it comes to the position of the fundus, it is a left or right or even in the top of belly button. Lastly, to detect the possible conditions, we have hemorrhage, blood clots, and full bladder. In assessment of the bladder, we need to ask the mother the last time when she went to the comfort room to void. Also remind her to try to empty her bladder for every 2 to 3 hours with or without assistance. It is also depend upon the mother's condition because full bladder is common to most postpartum women not to feel the urge because it decreases the muscle tone of the bladder. And it is also important to empty the bladder in order to prevent the urinary retention, bladder distension resulting to postpartum hemorrhage, faster healing, and less painful situation. So let's start now to ask the mother. Mommy, can I ask some question? Okay, thank you, Mommy. Mommy, when will the last time that you go to the comfort room to void? Oh, okay, Mommy. Mommy, make sure that you need to empty your bladder for every 2 to 3 hours, okay? Okay, Mommy, thank you so much. And then now, instruct the patient to do the proper perineal care or you can perform it to her. And then assuming that I already do the perineal care to the mother. And then after doing the perineal care, we need to change the peri pads now to the mother, okay? And then assuming that I already changed also the peri pads. After emptying the bladder, don't forget to recheck the fundal height of our patient. We need to inspect the fundus if there is no displacement. To assess the bowel sounds, the first thing that we need to do is to listen the bowel sounds of the mother using this stethoscope. Okay. There is no reason why a postpartum woman who delivered a normal vaginal delivery would not have bowel sounds. Instead, they will have active bowel sounds, okay? And then spinal anesthesia does not have an impact to the bowels and epidural anesthesia. Take note also that if a mother had a cesarean section and was under general anesthesia, the mother would have a hypoactive or absent bowel sounds in a short period of time only. And then next, ask the mother when was the last time she had anything to eat or drink. Okay? Mommy, can I ask some question again? Okay, thank you so much, Mommy. Mommy, when was the last time you had anything in your stomach like food or drinks? Oh, okay, Mommy, that's good. That's very good if that's so. Because, Mommy, don't forget to take or to eat your food, okay? Okay, thank you so much because you will be needing a lot of energy, especially when you will give a breastfeed to your child, okay? Okay, thank you so much, Mommy. And then most postpartum women, they have been NPO for a long time or long period of time and they don't realize that after the baby is born, they allowed to eat anything they want but depending if they have food restrictions like comorbidity or food allergies. Okay? And then then we need to encourage them to eat because they need calories and energy, especially if they will be giving breastfeed to her child. In assessment of lochia, first adjust slightly the head part of the bed or place one pillow on the head part of the mother. Okay, like this. And then this will prevent the mother staying in long flat position. And now we can check the lochia and emphasize to the mother about taking note of the presence and size of blood clot import. It is also important to inform the nurse about bleeding. Don't forget also to discuss and differentiate the different types of lochia such as the rubra, serosa, and alba. The normal size of blood clots is size of coin and the abnormal size is egg or bigger than the size of the egg. So let's check. Remove. And then, assuming that this is the dress of the mother, and then put down the panty. Okay, so let's see. Okay, the lochia discharge is like the size of the coin and which is normal. Next, change the peripad every 2 to 3 hours after perineal care has done and to provide and prevent the urinary tract infection or the UTI to our patient. So, assuming that I already washed the perineal care of our mother and then I already changed the peripad, okay? In assessment of episiotomy, check the perineum if there is a first, second, third, or fourth laceration. But some women do not give episiotomy anymore. Checking the perineum will help the nurses to know the degree of laceration. Assess the degree of laceration of the perineum by using the Rida scale or the episiotomy healing assessment. First, we have the letter R, which means the redness. Take note any redness at the episiotomy site, okay? And then some is slightly redness, some is slightly edema, and some is slightly bruising from a laceration to the episiotomy site, which are normal, okay? Okay, the redness is visible slightly. Next is the letter E, which means the ecchymosis, and check for the bruising. And then for the second letter E is the edema, and by this we can check for the swelling of the episiotomy site. Make sure that it is not slightly over and beyond because it is not normal. Okay, there is absence of ecchymosis and edema. Next is the letter D, which means the discharge or the drainage. Check the absence of discharge if it is normal. Okay. Okay, the discharge or drainage of the mother is normal. Take note that the presence of discharge or the drainage, which is the pus, in episiotomy site is not normal and it is a sign of infection, okay? For the last, we have the letter A, which means the approximation. By this, we can check if there should be no opening in the sutures done. If there is no opening, it is normal. Okay, the cutted skin area are well sutured and there is no presence of opening. It is like this. If there is a gap, it is like this. Okay? Gaps or any active bleeding in that area and space in between the episiotomy or the suture or not well approximated is considered as not normal. Okay, and then lastly, emphasize to the patient that sutures in episiotomy do not need to be removed because there is because they are dissolvable and don't need to make a separate doctor's appointment to get the sutures removed. Okay, and then because there are patients may ask about suture removal, and as a nurse, we need to give proper information regarding the suture to our patient. For the assessment of human signs, first, we need to check for the deep vein thrombosis or the DVT because pregnancy, delivery, and postpartum is hypercoagulable state, which makes the postpartum mother is at high risk for a DVT. Next, we need to expose the mother's legs for proper positioning. Okay, mother, please allow me to extend your legs. Is that okay with you? Okay. Okay, thank you. And then next, we need to support the back of knee of the mother or the patient using our hands because sometimes the patient would like to help or they may like to hold their legs straight out for us. Don't forget also to inform them not to do that and just relax their legs because us, the nurses, will be holding it for them using our hands. Okay? Okay, mommy, please allow me to support your knees by holding it. Okay? And then just relax, okay? Okay. Okay. And then while the patient is in relaxed position, we can now dorsiflex the foot back. Okay? And then don't forget also to ask for any pain or tenderness. Okay, mother, is there any pain or tenderness in your calf or in your legs?
None.
Okay, mother, thank you. Okay, and then don't forget that the presence of pain or tenderness in the calf means there is a positive human signs and there is a presence of deep vein thrombosis or the DVT. Otherwise, absence of pain or tenderness, which means there is a negative human signs. Next, we can now assess and inspect in the calf for redness, swelling, and heat. Okay, the mother's calf is in the normal condition. There is an absence of redness, swelling, and heat. Take note that the absence of pain or tenderness, it doesn't mean that the mother doesn't have a DVT because 50% of the DVT is asymptomatic. We can now check for the pedal pulses. Okay, by checking the pedal pulses, it should be absent or ready. Redness or swelling in the calf is not normal also. Doesn't match to the other leg is not normal. Even the human signs is a negative. And lastly, assess the other leg for the DVT and do the same like in the other leg a while ago. Okay? Okay, mother. Is there any pain or tenderness?
None.
Okay, thank you. And lastly, for the assessment of emotional status, we must assess the patient using our observation. First, we need to ask ourselves, how is the mother acting? Is she happy, crying, lot of pain, or exhausted? We need to observe this to check the physical, psychological, and emotional status of the mother. Second is she holding her baby? Is she calling her baby by his or her name? This will be the sign of good mother and infant or child bonding. And third, is she just sitting and using her cell phone while the baby is crying and screaming? By this will be the sign of lack of interaction or lack of wanting to hold the baby. And lastly, we need also to assess the support systems of the mother, which are the father or the significant others. And don't forget also to observe the 3 stages of Reba-Ruben, which are the taking in, taking hold, and letting go phase. Okay? In taking in phase, the mother is hungry, tired, and in pain, and telling story about birth story to her family and friends. In taking hold phase, the mother is interested in the baby and wants to take care of her baby, like asking question how to take care of her baby. And for the lastly, for the letting go phase, it may seen in the house wherein the mother establishes some routines in taking care of her baby. Of course, after doing all the assessment in your mother, don't forget to report or to document all the procedures and findings that you have done to your patient.